Good. I'm sitting here today with Jim, and Jim, you're in from Seattle, and you came to me just under 2 years ago, and you had some low back pain that we determined was from some arthritis and some enthesopathy,
Right.
and you had some knee pain, also arthritis,
Right.
and you had some both knees, and you had one left shoulder pain from some arthritis, and then also from some tendinopathy, and we did bone marrow derived stem cells into your low back, into your knees, and into your left shoulder. And then we did a second treatment a couple of months after that, just into your knees.
That's right.
And then tell me a little bit about what your pain was like before you came to me the first time, and then how you've been these last almost 2 years.
Well, the first time, well, let me say, I have my primary activity is competitive volleyball, and I'd gotten to the point 2 years ago where the pain was just too much. I couldn't no longer compete, especially my knees. My shoulder was bothering me. My lower back started to bother me. So I got the initial round of treatment, came back for a second round 2 months later. Probably I was back playing at a competitive level again within 3 or 4 months after the second round of treatment. It allowed me, 8 or 9 months ago to go to the national tournament and play 3-day long tournament. I was back playing at a competitive level again. But since then, gradually over time, it's gotten to the point where the knees now are painful enough again that it seemed like it was time for another treatment.
Just in the last few months, they started bothering you again.
Yeah. I played another national tournament in October, and that I actually played 2 different age groups.
That's great.
8 days of
Wow.
competition.
That's terrific.
So that kind of did me in, I think.
Okay.
It might have been a little too much.
Okay. Well, if you had to pick a percentage overall improvement, what would you say you've had from the stem cell treatment?
Well, I think initially it peaked out at probably 70–80%. It was never totally pain-free, but I certainly could play through it at that point. Kind of pushed the clock back about 7 or 8 years.
That's great.
But like I said, it's come back now a bit.
But it's still improved from baseline.
It's still improved. My day-to-day life has improved.
Great. That's great. So now we're 2 years out from the first one. We're going to do a little tune-up on your knees.
That's right.
Great. Okay, super. Well, I'm thrilled for you.